When a woman is pregnant, throughout the entire gestation, she may experience a variety of symptoms. One of them is the future mom's belly beginning to feel hard. In this AllForBabies video, we'll explore whether it's normal to have a hard belly during pregnancy, depending on the trimester, and if it's accompanied by other symptoms. Let's get started. Is it normal to have a hard belly during pregnancy? During pregnancy, it's quite common to reach a point where you start feeling that your belly becomes firmer. The origin of this sensation of hardness and tension in the abdomen will depend on the trimester you're in, as well as any other associated pregnancy symptoms. How should the belly be during pregnancy? The condition and shape of each pregnant woman's belly will depend on her body and constitution. In cases where women are very thin, it's common for them to have a toned and hard stomach, especially as the pregnancy progresses and their belly grows. Conversely, in women who are obese before pregnancy, the pregnancy is more discreet. With varying amounts of fat accumulated in the abdomen, the belly will be softer until the stomach has stretched enough to provide that tension and hardness. When does the belly start to become hard during pregnancy? We can encounter hard bellies throughout the entire pregnancy, and each trimester is attributed to different causes. Let's see what happens in each phase. In the first trimester of pregnancy, abdominal hardness usually appears around 8 weeks of gestation. One of the most common causes is constipation, resulting from significant hormonal changes, especially at the beginning. In these cases, the belly could feel hard throughout the day. In the second trimester, the belly grows, and the abdominal muscles and ligaments involved stretch more and more, potentially causing inflammation of the round ligament. Additionally, Braxton Hicks contractions may begin, characterized by the sudden hardening of the stomach, irregular intensity, no rhythm, discomfort but not pain, decreasing and eventually disappearing. These contractions are often more noticeable after exercise or sexual activity, with a full bladder, or due to dehydration. Finally, in the third trimester, various types of contractions appear, from Braxton Hicks contractions to prodromal contractions in the last weeks. These are more intense, as their function is to widen the cervix. And finally, we encounter true contractions during labor. These contractions, combined with constipation and inflammation of the round ligament, can cause hardness in the stomach. What does having a hard and painful belly indicate during pregnancy? When a hard belly is accompanied by other symptoms, it's best to see a doctor to evaluate the situation. For example, if you have contractions with pain, feel like you're going into labor, your water breaks, you have vaginal bleeding or fever, you should visit your gynecologist. You should also see a doctor if you notice that the baby is moving less or not feeling the baby's movements. Additionally, if you're in the first trimester, feel a hard belly with lower back pain, and experience vaginal bleeding, you may be experiencing a miscarriage. Finally, if you're in the final stretch of pregnancy and start feeling a hard and painful belly, it's most likely labor contractions. In case of any doubt, it's best to consult the healthcare professional overseeing your pregnancy to determine the cause and ensure everything is going well. See you in the next AllForBabies video.